cognitive behavioural therapy for psychosis. CBT is the main psychological treatment used in treating schizophrenia, and it works by modifying delusional beliefs and hallucinations within sufferers. CBT assumes it is these delusional beliefs which cause schizophrenia. These may occur due to incorrect interpretations the sufferer has of the world around them, themselves, such as thinking they can fly or a god, other people, or distorted perceptions on how to approach problems and goals. They may also hear nasty voices in their heads telling them to do bad things such as kill themselves. The aim of CBT is to help the patient identify these faulty and distorted beliefs and address them. Sessions are conducted for between 5 and 20 sessions for roughly an hour. The first stage of CBT is the assessment stage. The assessment begins by allowing the patient to express his or her own thoughts about their experiences whilst the therapist listens actively. The therapist has to be sure to make the patient feel as comfortable as possible and assure them that they do not have to say anything if they find it too distressing. The therapist first aims to develop a trusting and respectful relationship with the patient. They usually ask the patient about when their symptoms first started, how they developed, and to discuss any goals the patient may have. Then, the patient explains their confusing, distressing experiences, i.e., abusive voices. The engagement stage is the second stage of CBT, and throughout the therapy, the use of questioning is emphasised. This involves drawing out the person's own understanding of his situation and ways of coping with it through the process of guided discovery. Attempts are made to empathise with the patient's unique perspective and feelings of distress and to show flexibility at all times. The therapist stresses that he or she does not have all the answers, but that useful explanations can be developed in cooperation. Drawings may be used to display links between the sufferer's thoughts, actions and emotions, such as what they see or hear. One of the main techniques of CBT is based on Ellis's ABC model. It is based on a scale of 0 to 10 where the patient rates the intensity of distress. Cognitive reconstructing can occur by patients identifying their activating event, the A, exploring their beliefs, the B, and recognising the consequences, the C. For example, the belief that people won't like me if I tell them about my voices might be changed to a healthier belief of some people may find it interesting, some may not. People with schizophrenia are encouraged to reality test their hallucinations and delusions, in which the therapist and patient plan an activity that is designed to test the validity of a delusional belief. For example, if the patient thought they had a special power, the therapist would ask the patient to demonstrate it, or another option would be to question and try to accept and ignore the voices they hear. This is with the aim of reducing their levels of distress. The fourth stage of CBT is normalization. Normalizing the strategies are where the patient is taught to understand the nature of schizophrenic symptoms. By placing psychotic experiences on a continuum with normal experiences, the patient feels less alienated and the possibility of recovery seems more likely. For example, a therapist may say, "One thing I have learned from people I work with is that certain things make the voices louder and quieter." "What do you mean?" the patient might respond. "Well, one thing that seems to affect hearing voices is stress. Maybe you have noticed this. For example, if we are under a lot of stress, a new job, the car breaks down, getting into an argument, a lot more than we typically face, our body and mind react with discomfort. For some people they get headaches, back problems. For others who hear voices, the voices may get louder and more negative. Does that make sense to you? In the critical collaborative analysis stage, the therapist uses gentle questioning to help the patient understand illogical delusions and conclusions. For example, if your voices are real, why can't other people hear them? The questioning can be carried out without causing distress, providing there is an element of trust and providing the therapist remains empathetic and non-judgmental. The patient is sometimes given homework of applying one or more coping strategies whenever the target delusion or hallucination is experienced, and the therapist and patient discuss ways of making the coping strategies more effective. The final stage of CBT is developing alternative explanations, where the patient develops their own alternative explanations for their previously unhealthy assumptions. These healthier explanations might have been temporarily weakened by their dysfunctional thinking patterns, and hopefully now the patient will be able to cope better with their delusions and hallucinations thanks to the new coping methods the therapist has helped them come up with.